west side of the Clinton Square, or click our icon at DeWittDailyNews.com and see how our full lineup of State Farm insurance and financial services can help protect your family.
Local farm broadcaster Jared White covers the local agriculture news you need to know. Hear his reports by downloading the free WHOW mobile app.
Tune in to this RFD Radio Network affiliate Saturday mornings from 9:06 until 9:30 when we present the RFD Trading Post to advertise your farm-related items to buy, sell, trade, or give away. Call the toll-free number we give during the show to get your farm-related items advertised across the state and listed on RFDTradingPost.com. And find instructions on getting your farm-related items read on the show in our mailbag segment for 30 days for just $20. The RFD Trading Post, Saturday mornings from 9:06 till 9:30 on this RFD Radio Network station.
Let's swing open the farm gate together every day on WHOW. I'm Stu Ellis, your host of the long-running agriculture feature called The Farm Gate. I bring the latest news and information on where agriculture is and where it's going to WHOW Ag listeners several times a day. From tariffs to treaties, from the Board of Trade to the running board on your truck, I cover Central Illinois agriculture every day on The Farm Gate. Hear it all on WHOW's many platforms, on the radio or online. Join me, Stu Ellis, for The Farm Gate.
Hey, this is Todd Gleason from Illinois Extension here with a time change for our daily market report on WHOW. You can now catch our daily review of the commodity markets at 5:06 on all of WHOW's many platforms. You'll still hear all of our commodity analysts and weather professionals each afternoon, but at a brand new time. And you'll still hear the weekly wrap-up of the commodity markets right here on WHOW when Commodity Week airs Saturdays at 8:30 a.m. Remember the time change for the daily closing market report on WHOW at our new time, 5:06 p.m. weekdays.
Your friend in Central Illinois, WHOW.
Top of the morning. Thanks for being with us. The WHOW Morning Show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. I'm Seth Lawrence with you folks today. Thanks for being with us on the morning show. And Tony Kirkman is the executive director of the Piatt County Mental Health Center, and he joins us on the phone this morning. A good day, Tony. How are you, sir?
I'm doing well. How are you, sir?
Doing good. Thanks for asking. Thanks for making time for us, as always. It's good to have you on the program. I know times are busy for you, and so we appreciate you taking a few minutes out of your busy schedule to talk with us, and a lot of things on your radar this morning, Tony. You're talking with us a little bit about a grant that is going to make some tweaks, we should say, to community response to mental health crises for adults. What do you have for us? What's going on here?
Sure. So, the way that crisis mental health has been handled in the state of Illinois prior to what we're calling FY23, which started in July, is it was handled through a Department of Human Services grant that was called a Program 580 grant. And basically the way that the mental health crisis response was that an individual that was having some support needs would call. We would answer a 24-hour manned hotline, and then based upon the severity of that need, we would encourage that individual to visit a local hospital or emergency room where we would perform an assessment to determine if voluntary or involuntary placement needed to be made for mental health. And so that has been working for several years, and last year they changed that module to what they called a Program 590. And simply what that means is that now when a mental health situation arises, the program is requiring, one, that individuals or agencies like myself have to have a dedicated crisis worker. So in the past, I was able to use our therapists and then pay them an additional stipend if they were called out on office hours. Mm-hmm. That's not the case anymore. The state is saying, we want you to have a designated worker that does nothing else other than crisis. And quite frankly, for our county, our engagement numbers were not high enough to warrant a 40-hour FTE to respond to those needs. And so it just wasn't a really good use of taxpayer dollars. The other component of that is that instead of having one mental health professional respond, Now they are asking agencies to have what they call a certified recovery support specialist. So that's an individual that is a person with lived experience or a person with lived expertise of either going through recovery or having a pre-existing mental health issue and going through a certification process to respond to that crisis event at the same time. So now you have a clinician and a CRSS, where the idea is obviously the clinician has their clinical skills, but a CRSS has lived experience and could truly empathize from firsthand experience. And those individuals could respond to the scene of the mental health crisis.
Mm-hmm. So let's start with Tony. What do you like about this initiative?
I like the initiative of the idea of having a dyad approach for somebody that would say, okay, I don't have a strong enough rapport with a mental health professional, but this other individual knows, can empathize from a firsthand experience. I also like the idea of trying to figure out a way to reduce barriers to treatment. So, for example, there are parts of our county that are roughly 30 miles away from our critical access hospital.
Mm-hmm.
So it may be difficult for those individuals to find transportation to the assessment site. So that breaks down a lot of hurdles and gets the care as fast as it possibly can be directly delivered. So I like those components of it.
Mm-hmm. What do you not like about it? What concerns you?
The concerns I have are, one is responding to the scene of a mental health crisis. They call this a mobile crisis response. They're patterning it after the children's mental health crisis response, which is called SAS, Screening, Assessments, and Supportive Services.
Use social services
SAS,
and your acronyms, I tell you.
I know, right? We got a few of them. I like from the SAS component. Typically, you have a parent that is there. What can help, diffuse the situation, give you a lot of inside information, or help control the scene. When we come upon a situation where we don't have that, for example, and I'm going to blow it out of proportion, what happens if there's a mental health crisis that's responding to a dramatic or a significant traumatic experience, like a domestic violence situation?
Mm-hmm, mm-hmm.
We don't know who's all on that site, and it increases the physical liability, not only for my staff that are responding, but for those individuals that are in that room. So it does enhance the liability issue or just the risky factor of it.
Mm-hmm.
And then I am all for peer support services. And I think they're needed and they're wanted, and they are proven effective. But we do know in some circumstances that some mental health conditions are exacerbated by the presence of stress. And so my concern is, if we go into an uncontrolled area with a person with lived experience and it's a stressful situation, how do they apply coping skills to what internally is going on,
mm-hmm,
too?
Mm-hmm.
So all of that is kind of my job to worry about liabilities. My hope is that it's a great program and it's going to be effective and it's going to have great results. But I'm always kind of worst case scenario.
Mm-hmm. Well, and it sounds a lot like, and correct me if I'm wrong, but it sounds a lot like, when you had the whole, role of police in certain situations, that whole conversation, without getting into a political topic, this sounds a lot like the alternative solution or alternative, suggestion of, social workers responding to a scene of a crisis. That's
Mm-hmm.
what a lot of this sounds like. Am I off base in that assessment?
No, I think you're pretty accurate. And, I understand that the presence of a law enforcement officer might, in some rare circumstances, exacerbate mental health crisis issues, especially if those individuals experiencing those symptoms have had a negative interaction. But I will tell you, my 22 years of providing mental health services, it has always been a great collaborative with law enforcement. My experience is they understand their limitations and don't want to be social workers, and we understand our limitations and we don't want to be law enforcement. So there's a healthy working collaborative when we go out on the scene.
And that's just a piece of the conversation that a lot of people miss, quite frankly. I mean, it really is. That whether you're talking about, coastal news outlets, the national news outlets, that's just a piece of the conversation they miss, that there is a strong collaboration between law enforcement and social service agencies. I mean, I don't know, that's from the beginning. I felt that way, I guess.
Yeah, I don't disagree with you at all. And I think that, quite frankly, when we start doing these sweeping policy reforms, it's probably best to talk to the boots on the ground before you make those changes.
Well, that's just, Tony, now you're just talking crazy, okay?
I know, it's Friday.
Just step back for a second, guy. I'm just kidding with you. No, you're totally right. You're totally right. And Tony, with this policy though, just in terms of how it impacts, small communities like Monticello, Clinton, Hayworth, all these others in our listening area, is this a net good? Is this a net neutral? Like, how do you see this playing itself out?
Honestly, Seth, I think it's a wait and see.
Mm-hmm.
I will tell you, selfishly, from our program, is that my clinicians are extremely happy that we technically can't meet the criteria to take up that grant. And so that's just one less responsibility that's been put upon a underfunded community mental health center. And so we have partnered with our friends over at Heritage Behavioral Health Center, and they do a magnificent job. They have been our SaaS provider for Piatt County for many, many years. And so, to my knowledge, Heritage is picking up the SaaS and the adult mental health crisis program for both Macon, DeWitt, and Piatt. And hopefully, they're able to staff that up. And it's sad because you have to now push out your geographical area to meet some of the criteria for, those FTEs for just crisis. But Heritage does a great job. We are so thankful that they are a collaborator with us. And I think it's just a wait and see.
Sure. All right, Tony. Well, I'll tell you what, with that, let's take a time out. Tony Kirkman, Executive Director of the Piatt County Mental Health Center, is my guest on the phone here for this morning. We've got more with him coming your way on the WHOW Morning Show.
WHOW.
DeWittDailyNews.com is the area's leading local news source 24 hours a day, 7 days a week. Get the latest local news, obituaries, police splatter, weather forecast, and more with no paywall. Head to DeWittDailyNews.com to get the local information you need to know.
For the latest in Central Illinois agricultural news, visit IllinoisFarmRadio.com. Get updated information on markets, weather, ag news, local interviews with NAFB farm broadcaster Jared White, and much, much more. All at IllinoisFarmRadio.com.
This is John Carter, Chief of Police in Monticello. As a law enforcement officer, I've seen the impact that depression and suicide have on people. Many times, those contemplating suicide endure considerable suffering and distress. But there is help. If you feel depressed or lonely, there are many resources to help you. Call a trusted relative, friend, or minister, or call the Suicide Prevention Lifeline toll-free at 800-273-TALK. That's 800-273-TALK. All of us are here to help.
Are you experiencing symptoms such as numbness, tingling, weakness, or other neurological symptoms? Warner Hospital provides neurology health services to DeWitt County with Gibson Area Hospital and Dr. Donna Lorenzo, dedicated to providing the highest level of care for your neurology health, specializing in diagnosing and treating conditions such as TIA, stroke, epilepsy, dementia, Parkinson's disease, ALS, and more, including performing EMGs. To book your appointment with Dr. Lorenzo at the Warner Specialty Clinic in Clinton, call 217-784-2340.
The WHOW Morning Show is now video streamed live on the WHOW WEZC DeWittDailyNews.com Facebook page and on the new WHOW TV YouTube channel. Watch morning show host Seth Lawrence interview guests live, as well as watch archived video podcasts of any interview you missed. Whether on Facebook or YouTube, we're providing 2 more ways that Central Illinois' local news station, WHOW, delivers compelling content for you.
Your friend in Central Illinois, WHOW.
Once again, good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show is streaming to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Again, Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone here for this morning. Tony, I know that we have talked about this at length in our last several visits, dating back to probably late last year in the wintertime. And it's finally starting to kind of come into the picture, starting to come together. The Illinois Youth Survey, I know you've been anxiously awaiting this, not only the process, but now the results. And you've got a little bit of data that you can point to. What do you have, and what do you know? What are you finding?
Yeah, so I'm you're exactly right. We've been anxiously waiting to see what this data is coming out. And like a good person in social work, I'll throw a few more acronyms at you. So the U of I School of Social Work, Center for Prevention, Research, and Development, CPRD, every 2 years helps facilitate the Illinois Youth Survey, the IYS. And that is a self-report of all 8th, 10th, and 12th graders of participating agencies. And so we're ecstatic that we were able to conduct the IYS this year. As you know, 2 years ago, there was a little thing called COVID that popped up and knocked out a lot of our data. So this is the first time we're getting to look at what did COVID do to individuals' mental wellness? What did the legalization of marijuana do to our students? And I have been so incredibly blessed that 4 of the largest school districts in the DeWitt Piott County area have shared their results with us. We don't have full countywide data yet, but I was able to pull together some of the data taken from those 4 largest districts, and they're going to give us a pretty good sample set to see what we got, what we're working with.
So in summary, what have you found, Tony?
I have found that the legalization of marijuana has drastically affected individuals' access to marijuana. It has dropped the perceived risk of harm by both parents and by the students. In fact, when we're looking at the original data, it appears that parents are more willing to talk to their kids about the dangers and risks of alcohol and minimize those risks with marijuana. And then their mental health wellness reports, still very concerning. Over 25% of the 10th and 12th graders that were asked the question during the past 12 months, did you ever consider suicide? A quarter of our population has affirmed that answer.
Man, that and the component about normalizing, I guess, is the way to put it. Marijuana use in our kids, that's alarming to me, because there are, I'm sure you can speak to this, Tony. There are many studies over the years that show that marijuana use by teenagers is detrimental to not only health but mental health and those things.
Yeah, I would throw out 2 quick stats for you. Is so when they're asked the question of, I have used marijuana in the past year, 11% of the 8th graders, 21.4% of the 10th graders, and 28% of the 12th graders have affirmed, yes, I have used marijuana in the last year. And secondly is, out of those students that said, I have used marijuana, when they are questioned of where did you get it from, 9.6% of the 8th graders, 25.8% of the 10th graders, and 13.8% of the 12th graders said that I received my marijuana knowingly from my parents.
Wow, man. So now the question kind of becomes messaging and moving forward, and I guess creating awareness around the bad things, if you will, for lack of a more sophisticated way to say it, the bad things that can happen to us when you start entering this realm. How about that? What's your thought on how you move forward, Tony?
I think you're exactly right, Seth. I mean, regardless of how you feel about the legalization or the usage of marijuana, the reality is that these parents are knowingly introducing a mind-altering substance to a brain that is yet to be fully developed, because we know brains aren't fully developed until the age of 25. Last part of the brain to develop is prefrontal cortex, and those are some really important executive functions there. That's moral reasoning, risk assessment, emotional regulation, empathy, social skill development, all of these things that will help in advanced emotional intelligence. And we are manipulating that brain and not allowing it to develop without these substances present. So I think you're exactly right. I think that while I'm very proud of our prevention services that go into the schools and very thankful for the schools for their collaboration to deliver this youth prevention education, the reality is that we need to be engaging the parents and saying, one, there are some significant risks to marijuana use, but secondly is this permissive parenting of, well, you're going to do it, I want you to do it in the process of my home, is very, very dangerous to be doing.
Do folks like yourself in a leadership position in an institution like a mental health center, do you call on the state to aid you in this messaging and raising awareness on these things? Do you present this data to them and say, this is alarming, we need to do something about it? Or do you say, we have to fight this battle locally and we'll take this fight up ourselves? How do you handle that?
Well, I'll be honest with you, is I don't take this data to the state. I'm hoping that the School of Social Work will have statewide data, which will be significantly more influential. Instead of just saying, oh, that's a small local issue, we can say, no, it's a statewide issue that we need to address. I have yet to see a grant that addresses the adult population for permissive parenting. It's needed. And I think one of the other things is we need to be talking about helpful ways for people to navigate depression, anxiety. A lot of the reasons why we're using marijuana is we're self-medicating for other issues. Yeah, and they found that it works. And it's like, okay, well, I have a problem whenever I look at the stats and they say that in the last 5 years, youth antidepressant usage has increased by 41%. And out of the kids that are getting medication for a mental health issue, only 1 out of 3 are also getting behavioral health support. So we can't medicate ourselves out of this problem. We got to figure out how to do therapy as well as doing medication. It's this integrated approach that it proves itself to be more efficient in treatment.
Tony, let's end it there. Maybe next time we can get more data from you and more thoughts as well. Tony Kirkman, Executive Director of the Piatt County Mental Health Center, is my guest on the phone. Network News on the way.